Hello students, welcome back to Next Level Academy JIPMER exam questions 2022 with the explanation. This is part 2. Okay, let's move on to the question. Golden color amniotic fluid expected finding in. As a nurse, when you see golden color amniotic fluid, so what will you expect? Option A, meconium aspiration. Option B, RH incompatibility. Option C, acute fetal distress. And option D, fetal death. Let's see. What is meconium aspiration? Meconium aspiration is nothing but when the fetus is delivered, which means the newborn, which breathes a mixture of meconium and the amniotic fluid will enter into the lungs, okay, around the time of the delivery. Okay, that is called meconium aspiration. Next is RH incompatibility. This has a big explanation. I have to explain it in a better way. Yes, imagine if a mother is RH negative and a fetus is RH positive. So while delivery, what happens while cutting the umbilical cord? The positive, RH positive's antibody will enter into the mother's placenta, and this will enter into the blood circulation, and the mother will have RH positive antibodies. So when she gets pregnant again, the RH, if the fetus is RH negative, there'll not be any issue. And if the fetus is Rh positive, what happens? So this will destruct the RBCs. So the fetus will be aborted. Next, we shall see the acute fetal distress. Here, I forgot to say something. Okay, so what happens when the RBCs are destructed? What happens? So this will get separated, destroyed, and this will become kind of a yellow color, golden color. Okay, amniotic fluid. This will be dissolved. So hope you might have guessed the answer. Let me explain the option C too. Acute fetal distress. So acute fetal distress is nothing but this. If in the word itself, you can understand fetal distress. The fetus, when the uh, the fetus lacks in the oxygen, okay, which means the oxygen deprivation during labor or before labor. So there'll be changes in the heart rate, movement of or sign of the oxygen, okay, of the fetus while on the labor or before the labor. Next is fetal death. Fetal death is nothing but after 20 weeks of gestation, which means 5 months of gestation. If the fetus is dead in the uterine cavity, so that you call it as fetal death. Or while the delivery, if you find if after 20 weeks of gestation, while on delivering, the baby is found dead, okay, they can call it as even stillbirth. Both are same. So you might have guessed the right option. The golden color amniotic fluid is expected finding in option B, RH incompatibility, because when the RBCs are destroyed, so that will get destroyed, and you can see the golden color amniotic fluid change. Next, we shall move on to the next question. During birth, the neonate weight is 3 kg. The baby weight expected at 5th month is what? Can you guess the answer? Okay, I'll tell you. Option A is 7 kg. Option B is 6 kg. Option C is 4.7 kg. And option D is 5 kg. So I'll tell you a shortcut. When the baby, as per the WHO, the ideal weight of the baby will be 2.5 kg to 3.5 kg as per Indian scenario, Indian babies. So when the baby is delivered. So this will be the range. So when it completes 4 months, so the weight doubles. When it completes 1 year, which means 12 months, the weight triples. So you can imagine. So here, expected the fifth month. Okay. Imagine if the baby is around approx 3 kg. Okay. So the expected weight would be 6 kg. So the option is B, 6 kg. As per the question, it is given 3 kg. So it will double, okay, when it completes 4 months. So it is near to fifth month. Okay. So it will be approx 6 kg. Next, we shall move on to the next question. Patient has dyspnea. What is the best position to relieve? I think this is an easy question. Okay, let me explain. Option A, Holder's position. Option B, Sims position. Option C, Trendelenburg position. And option D is supine position. So what would be the answer? If the patient is having dyspnea, the best position is, obviously it is Fowler's position. Why? Because the patient will have a proper appropriate lung expansion in this position, Fowler's position, because it will be 45 degree. Next is the woman identifies with a single cervix and its end with two uterus is known as the woman identified with single cervix which ends with two uterus. Normally, a woman will have a single cervix and single uterus, but here the question you have to understand is two uterus. It happens rarely. So, what do you mean? Okay, let me list down the options. The first is unicornuate uterus. Option B, bicornuate uterus. Option C, uterine septum. And option D, arcuate uterus. What would be the answer? Cornu means cornu means it's a horn-shaped anatomical part of a uterus. Okay, so obviously you can guess. Unicorn is it represents single cornuate. Option B, bicorn, which means bi, two. This is single and this is two. Uterine septum, which has no relevant with the meaning, and arcuate is also has no relevance with the question. So you can guess the answer is B. So this is it. This is a normal uterus which has a single cervix and single uterus. But over here you can see a single cervix and two uterus. This is called bicornuate. Next, we shall move on to the next question. The International Day of Charity is observed in option A, 18th December, option B, 5th September, option C, 28th September, option D, 5th March. Usually, you will be confused with the dates and the year. It's a bit difficult, but you can have a shortcut, okay, to remember. These things, it's a big challenging task, but I can give you a tip. The option is B, 5th September. To remember this, I can give you a tip because Mother Teresa passed away in 5th September. To remember that, they have kept this International Day of Charity for their remembrance. Handwriting is ugly. So hope you can understand, I think. Next question is, person knows about self and aware about his illness is what? Option A, memory. Option B, insight. Option C, judgment. And option D is abstraction. What is called memory? Memory, remembering. And what is insight? Insight you can understand. Sight is awareness. In means inside awareness. Option C is judgment, which is not the right answer. Option D is abstraction. Abstraction is nothing but you have an idea, a whole idea. Okay. It's not a specific idea, just a whole idea of something. It's called abstraction. So you can guess the answer. The answer is B, insight. It's a psychiatric question. You know that. We shall move on to the next question. Fetal well-being, body movements, muscle tone, breathing movements, amniotic fluid, and heartbeat volume measured by option A, non-stress test, option B, triple test, option C, biophysical profile, option D, cardiotocography. Okay. Let's see one by one. Non-stress test. So before discussing this option, I'll just move on to the question again. You can see body movements, 2, muscle tone, and 3, breathing movements, 4, amniotic fluid, and heartbeat. Okay. These are the 5 parameters, 5 parameters of biophysical profile. Option A is non-stress test. What is called non-stress test? Non-stress test is nothing but which is done to check whether the mother is tolerating the uh, uterine stress while on delivery. B is triple test, which means to detect the possibility of the neural tube defect, Down syndrome, and trisomy 18. And next is cardiotocography. Cardiotocography is nothing but to read the heartbeat of the fetus through the ultrasound. Now, you might have guessed the answer would be the biophysical profile. Why so? As I told you, there are 5 parameters: body movements, muscle tone, breathing movements, amniotic fluid, and heartbeat volume. Okay, these are the 5 biophysical profile. Let's move on to the next question. How many hours after cesarean section the breastfeeding should be initiated? Option A, 30 minutes. Option B, 4 hours. Option C, 2 hours. Option D, 1 hour. The right option is B, 4 hours. Why? Because the mother will be on the anesthetic effect. So anesthetic effect, it will get relieved on, it will take approx 4 hours. So the post anesthetic effect is 4 hours. That is the answer. So after the cesarean section, well, cesarean section, obviously they'll give anesthesia. So when the mother is in anesthesia, she can't breastfeed. So post anesthetic effect, after 4 hours, she can breastfeed. Suppose if it is a normal delivery, so when she can breastfeed, obviously it's very easy after 30 minutes because here the mother will not be given anesthesia. Next question, which is not the defense mechanism in the following? Option A, adaptation. Option B, intellectualization. Option C, sublimation. Option D, suppression. Let's see, adaptation. Adaptation is nothing but someone is getting adapted to the environment which is new for him, it's unfamiliar. So that's called you say adaptation. Option B, intellectualization. Intellectualization is nothing but suppose if you have a exam tomorrow. Exam is a kind of an anxiety. So to get through that anxiety, what do? You prepare well to overcome the anxiety. It's the best example for intellectualization, I can say. And next is sublimation. Sublimation is nothing but I can give you an example. If suppose a person is angry, is an angry person, when he shows this angry in the society will not accept it because here we have a law, rules and regulations. Okay, so he'll be caught by the police. So to accept that in the society in a social way, what he does, he becomes a karate master or kickboxing or kung fu. So that will be accepted in the society. When he boxes, he shows his anger in the boxing, the society will accept because it's a game. Option D is suppression. Suppression is nothing but is voluntarily is repressing the negative emotions, negative thoughts and emotions which he has to forget. Okay, he's voluntarily suppressing. Okay, that is called suppression. So here, which is not the defense mechanism, is adaptation. We shall move to the next question. The client is receiving blood transfusion. Nurse observes respiration 24 breaths per minute, pulse 84 beats per minute, and blood pressure 80 by 50 mmHg. What is the priority care given by a nurse? Option A, stop the blood transfusion. B, inform the physician. Option C, administer IV bolus of normal saline. D, continue the blood transfusion. First of all, you have to understand why there is a blood transfusion. When the blood pressure falls slightly, imagine the patient has normal blood pressure will be it is 180 by 80 mmHg. Suppose if it falls by 100 by 70 to stabilize the blood pressure, they start NS. Then they'll go for, suppose if it reduces below that, okay, they'll go for plasma expander. And if it is not possible, it is going most the lesser level, which is like blood pressure 80 to 50, they'll go for blood transfusion. So that's the reason they have gone for blood transfusion. But here the patient is receiving blood transfusion and the blood pressure is 80 to 50. What is the priority care given? That's the question. Stopping the blood transfusion will lead to nothing. Inform the physician. Obviously, you have to inform the physician. Okay. Next is administer IV bolus of normal saline. This is also not possible because patient is already taking blood transfusion and you are administering IV bolus normal saline will have no change at all. And next is continue the blood transfusion. So already the patient is blood pressure is 80 to 50 mmHg. You have to continue the blood transfusion. D is the right answer. Okay, students, I hope you would have understood everything, the explanation. If you want to give a feedback, if you don't understand my handwriting and explanation, please comment. And thank you for cooperating. Thank you for observing. And if you want to like, subscribe, share, please do it, and I expect your feedback. Thank you once again. We'll meet on the next video.